When a client suffers from an auto accident, it is vital that the client gets their injuries and pains compensated for to the full extent of the law. It's often difficult to determine how much a client's case is actually worth and how debilitating their injuries are. And that goes for not just immediate results of the accident, but the sequelae of symptoms that occur and continue long after the case has passed. By utilizing the information and steps in this lecture, you can gain better analysis of how life-changing the client's accident truly is, and in turn provide evidence for a higher settlement in favor of the client. In this first video, we will overview the phases in which tissue heals after an injury. That's step 1. This information is important to know for sprain strain cases, whiplash cases, general spine and lower back pain cases, as well as extremity pains. In the videos to come, we'll learn about how to effectively objectify the lesion with objective measurements, how to properly report on the lesion, and finally we'll discuss Colossus and other softwares that insurance companies use to value a case. So to start, in step 1, we have to understand the 3 phases of the healing process, and this is specific to tissue that gets damaged in the injury. The first phase is the acute inflammatory phase, also known as the reaction phase. Now this comes from Roy and Kellett. It's been known for over 30 years that in the first 3 days following an injury, there is a lot of swelling and inflammation and pain. And redness and warmth are classic signs of inflammation. And the severity can be gauged and measured to see how much the injury may affect them long term. You always want to take immediate pictures of documentation during this time, and mainly in a clinical setting, the important part is to look at your subjective findings. You want to emphasize how the accident has affected the patient's activities of daily living, and measuring how much their pain and how much they've been limited in their function, not just how they're feeling, but how much they've actually been debilitated in their daily activities. This can be driving, sleep comfort, work comfort, if there is time off of work. There's a lot of factors that can be looked at. And you want to use proven, standardized questionnaires to document the pain and disability as soon as possible after the accident. So some examples that we use in our office, we use the impairment rating scale and the Oswestry pain and disability scale. And these measure your active daily living questions in the form of, as we just kind of went over, sleep, work, eating, daily habits, mobility, all the things that you do that can be affected other than pain. There's also, for specific injuries like whiplash and neck injuries, there's a neck disability scale, a low back disability scale, even headaches. Oftentimes we'll have patients have severe headaches or increased pain in their frequency of headaches after a car accident. And so there are questionnaires for that as well as an upper and lower extremity functional index questionnaire. Now when they say functional, that has to do with your muscle strength and muscle mobility, and that's another arena that's very important to look at. Now these are subjective, which are very important, but objective findings are also extremely important in proving a case's value, because objective meaning they can't be argued, they're not based on opinion, they're based on factual measurements. And we're going to talk more about that in the next video. Phase 2 is known as the repair regeneration phase, and can last anywhere between 72 hours and 6 weeks. This is the phase where the body breaks down the damaged tissue and attempts to lay down new tissue to replace it. In this process, we get what's called scar tissue. This is because when the body has to improve an area, it can only do so by laying down irregular patterns of fiber. It's almost like throwing a bunch of goop into the damaged area, like patching a pothole on the roads. And in doing so, the fibers are in a poorer pattern that can reduce range of motion in the area because it's thicker and it's not as flexible. And you also can have increased pain sensitivity because the body literally litters more pain receptors, known as nociceptors, in that area as kind of a guarding mechanism. And as a result of this, you can have sensation loss in the area. You also, in the worst scenarios, can have possible chronic pain as a result, due to altered neurology can cause things called wind-up syndromes, such as chronic regional pain syndrome. This in the old days was also known as reflex sympathetic dystrophy. And it happens because of a perpetuation of improper neurological signals being sent because of the damaged pain receptors. So it's important to do a thorough neurological exam in addition to specialized neurological imaging. And we'll typically recommend this very often after we see some of these things on our neurological exam. In phase 3 is known as the remodeling phase. This can last anywhere from 3 weeks to 12 months or more. And this is a very key pivotal phase that we want to improve the flexibility and function of that scar tissue. The collagen wants to be remodeled and is largely influenced by controlled motion and proper exercise. This is important because exercise therapy, chiropractic and physical therapy, which we provide in the office, helps improve the quality and orientation pattern of those individual fibers that have been littered in the sprain strain cases and injury cases. And this increases the tensile strength of those fibers. There's been research shown through microscopic research by Calliot and Gross that inactivity actually causes the collagen fibers to stick together, thus reducing the flexibility of that tissue, and that can affect long term when it's not addressed. So using objective measures, both measuring range of motion and functional strength, is critical in these cases. And the more objective the measurements are, the better they're going to stand up in court. So we're going to go over those measurements during the next video. The first step is understanding how the phases of healing work, and then how to chart and document for them. And if you stick with us, I hope you enjoyed this video. There's more to come. You can let us know if any questions. We'll be happy to talk about it. Thank you very much.